Okay, I'm Dr. Betita and I've been tasked to lecture on primary healthcare, determinants of health, and Ang Kwento ni Rosario, the documentary. All right, today we will discuss one of the most important concepts in medicine, primary healthcare, or PHC. As future physicians, your responsibility extends beyond diagnosing diseases and prescribing medications. You will also need to understand why patients become ill in the first place. We will also discuss social determinants of health and finally apply these concepts to the documentary Ang Kwento ni Rosario, where we examine how poverty and social conditions influence health. By the end of today's session, I hope you will begin seeing patients not merely as diseases to be treated, but as individuals living within families, communities, and society. So, by the end of this lecture, you should be able to first explain what primary healthcare is, identify the major social determinants of health, recognize health inequities, analyze Rosario's story using PHC principles, and identify possible interventions at the individual, family, community, and government levels. Remember that today's lecture is not simply about memorizing definitions, it is about changing the way we think as physicians. So, what determines health? Let's begin with a question. When someone becomes healthy, what contributes the most? Is it doctors? Is it hospitals? Is it medicines, genetics? Or perhaps income, education, housing, employment, and environment? Most people immediately think of doctors, hospitals, medicines, primarily because these are interventions that are given. The majority of health is determined by where people are born, grow, work, and live, and this realization completely changed public health over the last 50 years. As physicians, we often treat the consequences of poor social conditions rather than the causes. Okay. The modern concept of primary healthcare began in 1978 with the Alma Ata Declaration. The declaration promoted the vision of health for all. It recognized that health is a fundamental human right. It also introduced 8 essential elements of primary healthcare, including the following: health education, nutrition, safe water, maternal and child health, immunization, disease prevention, essential medicines, and appropriate treatment. PHC is a strategy for achieving social justice. In 2018, 40 years after the Alma Ata Declaration, countries met again in Kazakhstan to renew their commitment through the Astana Declaration. The principles remained the same but were updated for today's health challenges. Astana emphasized universal health coverage, community empowerment, multi-sectoral collaboration, and achieving the Sustainable Development Goals. Rather than focusing on only curing diseases, health systems should build healthier communities and populations. So, what is primary healthcare? According to the WHO, primary healthcare is a whole of society approach. Notice the words whole of society. Primary healthcare is much broader than seeing patients in clinics. It includes health promotion, disease prevention, treatment, rehabilitation, and palliative care. Primary healthcare begins before disease develops and continues throughout a person's life. So, we often confuse these two terms, primary care versus primary healthcare. Primary care refers to the clinical care delivered by physicians or other healthcare professionals. Primary healthcare is much broader. Primary care asks, what disease does this patient have? Primary healthcare asks, why did this patient become sick? Primary care focuses on the individual, while primary healthcare focuses on individuals, families, communities, and populations. One is clinical and the other is public health. So, why primary healthcare? Traditionally, healthcare starts after a disease appears. A patient becomes sick, he goes to the hospital, he sees a doctor. Primary healthcare reverses the sequence. Instead of waiting for illness, we promote healthy lifestyle, prevent disease, detect illness early, and only then provide treatment when necessary. The goal is to keep people healthy rather than waiting for them to become patients. The evolution of primary healthcare in the Philippines started with rural health units, which later became barangay health stations. The local government code devolved health services to LGUs. Then came Formula One for Health, which is a overarching strategy for health service delivery, which had 4 pillars, namely health financing, service delivery, health regulation, and good governance. This was implemented in 2005. And finally, in 2019, the Universal Healthcare Act institutionalized primary healthcare as the foundation of our health system. Notice that healthcare has gradually shifted from hospitals towards communities. Here we see the structure of our healthcare system. The Department of Health provides national leadership. Regional centers for health development coordinate implementation. Provincial and city health offices manage local programs. Barangay health stations serve as the community's first point of contact. And this demonstrates that healthcare is organized as a network rather than as a series of isolated hospitals. Many people assume that doctors alone provide primary care. Actually, primary health care depends on the entire team, composed of physicians, nurses, midwives, BHWs, dentists, pharmacists, and even community volunteers. All of these people contribute towards primary health care, and primary health care can only succeed because it is collaborative. RA 11223, or the Universal Healthcare Act, transformed healthcare in the Philippines. Its goals include automatic PhilHealth membership for all Filipino citizens, financial protection, strong primary care, better access to health services, and integrated care networks. The law also emphasizes that primary care should become every patient's first point of contact, and this shifts healthcare towards prevention and continuity. Okay. These six principles are essential to primary healthcare, namely accessibility, equity, community participation, health promotion, appropriate technology, intersectoral collaboration. These principles should guide every decision in primary healthcare. Community participation. Communities are not passive recipients of healthcare. Instead, they should be partners. Examples include barangay health workers, women's organizations, senior citizens groups, youth organizations, and indigenous leaders. Health programs became sustainable only when communities actively participate. Kasi syempre, pwede kasi na mag-introduce ka ng intervention and then your target population isn't willing to accept it or isn't willing to implement that. Okay. Can the Department of Health solve malnutrition alone? The answer to that is no. Education influences health. Agriculture influences nutrition through the availability of nutritious food. Housing affects infection because housing can affect hygiene. Transportation affects healthcare access. Employment affects income. And therefore, health requires a cooperation across many sectors. Medicine alone cannot solve every health problem. The WHO defines social determinants of health as the conditions in which people are born, grow, live, work, and age. These factors strongly influence health outcomes, and think of these as the causes behind the causes. Generally, you can think of these as education, access and quality, healthcare and quality, neighborhood and built environment, social and community context, and economic stability. These are broad categories of social determinants of health, but in general, the definition of social determinant is conditions in which people are born, live, work, and age. Okay. Dahlgren and Whitebird proposed this model, which illustrates the layers influencing health. At the center is the individual. Surrounding that are lifestyle behaviors. Surrounding the lifestyle behaviors are social relationships, and surrounding the social relationships are living and working conditions. Surrounding all of that is the larger economic and environmental context, and each layer has an influence on health. The WHO classifies determinants into structural determinants, such as education and income, and intermediate determinants, such as housing, nutrition, stress, and healthcare access. These ultimately determine health outcomes. Let's briefly discuss each determinant. So, income affects nutrition and healthcare access. Education improves health literacy. Employment provides financial security. Housing influences hygiene. Transportation affects clinical attendance. Political policies shape healthcare systems, and every determinant in turn influences health. Not every health difference is unfair. For example, older people naturally develop arthritis more frequently. That is a health difference. Older people are more at risk. That's why they are more prone to developing arthritis because of their age and their activity or lack thereof. But when poor children die from preventable diseases because they lack health care, that is a health iniquity. Health iniquities are unfair, avoidable, and socially produced. Many diseases disproportionately affect poor Filipinos, including stunting, tuberculosis, maternal mortality, dengue, and mental illness. These diseases often cluster where poverty exists. This illustrates the importance of primary health care. Consider two children. Child A lives in Metro Manila with good nutrition and access to pediatric services. Child B lives in a remote barangay without sanitation or transportation. Who is more likely to become sick? Most of you will probably answer child B. Why? Think of the social determinants that are applicable to child B. What social determinants are there that will place this child at greater risk of illness? Think about that on your own. Okay? Now we transition to today's documentary. As you watch Rosario's story, avoid asking what disease does she have. Instead, ask what social condition made this disease possible. Rosario's story represents thousands of Filipino families. It highlights poverty, social exclusion, limited healthcare access, and structural inequities. Although it tells the story of one family, it reflects broader societal problems. Okay, a physician diagnoses malnutrition. Primary healthcare asks why malnutrition occurred. Was food unavailable? Was healthcare inaccessible? Was employment unstable? Why is this family vulnerable? Why did the malnutrition take place in the first place? So, social determinants seen in the documentary included low income, poor housing conditions, limited opportunities due to low education, barriers to care, and marginalization due to poverty. Okay. Notice how these multiple determinants interact simultaneously in order to result in the negative outcomes in this case. Okay. Did Rosario become vulnerable due to poor choices, or was it because opportunities were limited? We need to distinguish between personal responsibility and structural barriers. Were there structural barriers which prevented Rosario from, uh, which made Rosario rather more vulnerable to illness? Or was this just because of bad choices on her part? So think about that as well. So applying primary healthcare. Possible interventions exist at multiple levels, including the individual, family, government, and community level. So at the individual level, the interventions would have included medical care and nutrition. Nutrition could have been in the form of, like, let's say, a feeding program, or maybe she could have been given um, vitamins or other medical intervention. Um, Hospitalization would have been an option here if it was necessary. Family support in the form of maternal and child health interventions. Maybe the barangay health worker could have gone to this particular family. Um, Social protection and poverty alleviation. And at the community level, this family could have benefited from health education and community support. Okay. Social determinants of health analysis. So, review each determinant and its consequences. Poverty delays care. Poor housing increases the risk of infection. Transportation limits the ability of the family to consult. Poor nutrition weakens immunity, and each determinant contributes to illness. Which primary healthcare principles were present? So, reflect on the documentary. Was care accessible? Was care affordable? Were the services available continuously? Was it community based? Was this death preventable? And were they patient centered in their approach to this particular patient? So think critically and evaluate the healthcare system inside of this documentary. If these interventions were implemented earlier, would Rosario have benefited? If we had given prenatal care, nutrition counseling, vaccination, community health worker visits, social services, and mental health support, would this particular patient have benefited? Where could primary health care have intervened? These are the possible interventions that could have been initiated. Pwedeng nakapagbigay ng health education, pwedeng dinalaw ng health worker, nag-nutrition program, nag-early screening, nag-social welfare referral. Your responsibilities as a physician extend beyond the diagnosis. You should become an advocate, an educator, a coordinator, a collaborator, and a leader. A physician's influence extends beyond the consultation room. So, as we conclude, remember these three ideas. Health begins where people live, work, and play, learn and play. Primary healthcare addresses the cause of illness before disease develops. Social determinants of health explain why some populations become sick more often than others. And as future physicians, do not simply ask, what disease does this patient have? Also ask, why did this patient become sick? And what can I do to change the conditions that caused it? That question is the essence of primary healthcare. Thank you. And if you have any questions, please let me know during our Q&A session. And these are my references. Thank you for your attention.